Welcome to the future of understanding. This is NeuroMind Insights, where we unlock the power of your mind.
In everyday life, your blood type is a passive identifier on a driver's license or a safety check for a routine donation. But a massive study published in the journal Neurology followed over 30,000 people and found that this single letter directly predicts cognitive decline. Add to that research from the American Heart Association showing non-O types face a significantly higher risk of heart failure, and that identifier becomes a map of your medical future. To understand why, imagine your red blood cells are tennis balls floating in a stream. On the surface of these cells are tiny spikes, or sticky patches, called antigens. Think of these antigens like biological Velcro. The specific style of Velcro on your cells determines whether your veins are pumping water or thick syrup. It also dictates exactly which viruses and bacteria can latch onto your system, turning a simple letter into an active biological target. Let's start with type O. If you have this blood type, your cells are completely naked. You have zero antigens. Because your blood is chemically slippery, you have naturally lower levels of a clotting protein called the von Willebrand factor. Having less of this biological glue means you have superflow blood, making you highly resistant to deep vein thrombosis and strokes caused by random clots. But if you get into a car accident or undergo major surgery, you bleed out much faster. Trauma surgeons often guess a patient is type O just by watching how hard it is to stop the bleeding on the table. The immediate danger for type O, however, is in the gut. Your naked blood cells still express a structure called the H antigen. Nasty bugs like cholera and H. pylori, the bacteria that causes stomach ulcers, have evolved to dock into this structure with surgical precision. They are biologically pre-programmed to inhabit your intestinal tract. That chemical resistance to clotting in your bloodstream comes at the exact cost of inviting severe bacterial infections into your digestive tract. Move over to type A, and the biological profile flips entirely. This blood is loaded with the A antigen and carries naturally higher levels of the stress hormone cortisol, making the blood much thicker and stickier. This hypercoagulability was excellent thousands of years ago, when surviving a predator scratch meant you needed to stop bleeding instantly. Today, sitting still in an office chair for 8 hours, that sticky blood clumps up, raising the risk of deep vein thrombosis and strokes. Type B blood, found in roughly 10% of the population, originates in the Himalayan highlands and carries a uniquely robust immune system. But that immune system runs hot. Type B individuals tend to have higher levels of C-reactive protein, a marker for inflammation. Over time, this creates rough, inflamed arteries and poor circulation, which is why your hands and feet might always feel cold. Worse, that B-style Velcro is the preferred anchor for pathogens like Salmonella and E. coli. They hijack your gut lining, resulting in longer-lasting food poisoning from undercooked meats and eggs. Possessing just a single antigen type shifts a person's primary mortal threat away from traumatic bleeding and towards sedentary lifestyles and specific dietary triggers. Then there is AB positive, found in less than 4% of the population. Carrying both A and B Velcro makes you the universal recipient for blood transfusions. Having both antigens triggers a specific clotting response called factor VIII. When combined with the vascular inflammation of the B profile, this creates a sludge effect inside the tiny microvessels of the brain. This chart reveals the long-term damage of that poor microcirculation. Over decades, as tiny vessels clog up, brain cells are slowly starved of oxygen, leaving people with AB blood an 82% higher likelihood of developing memory loss and cognitive decline compared to other types. Being the ultimate biological receiver offers a massive advantage in an emergency room, but exacts a suffocating toll on your neural pathways as you age. Now we enter the negative zone. Only 15% of humans have a minus sign next to their blood type, and biologically, this means you are missing a specific protein called the rhesus, or Rh factor. This missing protein can trigger biological hostility during pregnancy. If an Rh-negative mother carries an Rh-positive baby, her white blood cells can cross the placenta and actively attack the fetus's red blood cells, treating them like a foreign invader. For O-negative individuals, the math is equally grim. You have zero antigens and no Rh factor, making you the hero of the emergency room who can donate to anyone. But if you're in a massive wreck, the hospital can only give you rare O-negative blood, and if the supply runs dry, you have zero backup options. Lacking a single microscopic protein limits your medical safety net to a fraction of the population, turning severe trauma into a terrifying mathematical gamble. Identifying these risks allows for targeted safety loops. If you are type O, guard your vulnerable gut lining by avoiding chronic antacid use and explicitly warn your surgeons ahead of time that you bleed easily. If you are type A, treat movement as mandatory medicine. Do not sit for more than 45 minutes at a time to keep your blood from pooling, and consume plant-based natural thinners like garlic and ginger. If you are type B, practice hypervigilant food hygiene to keep gut pathogens away, and eat nitric oxide-rich foods like beets to physically dilate your inflamed blood vessels. If you are type AB, intentionally protect your brain's microcirculation. Rigorous cardiovascular exercise and keeping your blood pressure strictly low are critical to clearing out cellular sludge. And if you carry any negative blood type, utilize autologous donation. By banking your own blood weeks in advance of a planned surgery, you bypass the fragile public supply entirely. While the medical system often treats patients like broad statistics, your blood type provides the specific instructions needed to manage the physiological risks your biology already predicts.
Thank you for watching. If you enjoyed this video, please like, comment, share, and subscribe to NeuroMind Insights for more.